Why did this 52-year-old family physician invest heavily in the disruptive EXOMIND TMS, brain optimization and mental wellness device? Well, it's personal for me. I'm Dr. Jamie Glover. I'm a family physician in Monument, Colorado at Glover Family Medicine. I also do hormone optimization and brain optimization. For me, it's personal. When I was a young officer in the Air Force, after my second baby, I experienced a pretty severe postpartum depression, and it got to the point where I decided I need medication as a tool to help me through. And the first medication I tried, unfortunately, gave me an adverse effect, which would be called a hypomanic reaction. I like to say that I ended up telling off the whole Air Force. And it turns out that's not a good thing when you're an officer in the military. I ended up trying a couple other medications, all with side effects, and I made it through by the skin of my teeth. Since then, mental health and wellness and prevention of mental deterioration has been really important to me, and I have not been able to wait to bring it into my practice. So recently, when my landlord interfered with my ability to bring in a psychologist and counseling company into my practice, I decided to invest in a device for something that I've always wanted myself, and that is transcranial magnetic stimulation. Now, TMS has been researched since the 80s and came about in clinical use in the 90s. It was FDA approved in about 2008, and that was about the time I was having my trouble in the Air Force with my postpartum depression. Now, if EXOMIND TMS had been around at the time, I would have loved to have tried it. So the problem with traditional TMS, which is a wonderful treatment, often better than talk therapy or medication therapy for many diagnosed mental health disorders, is that it has been inaccessible. It's been expensive. It takes often 36 sessions for an initial protocol, and those are done 5 days a week for often 6 weeks in a row. Nobody has the time or money for that, or for insurance to cover such a thing. A person has to often fail something like 3 other medications, and not everyone wants to walk through and continue to fail and have side effects and adverse effects to medications. Now, medications can still be a good tool for some, but for many of us, they just don't cut it. And so now with EXOMIND TMS, it's FDA cleared to treat major depressive disorder, but also I can use it to treat just mental symptoms, even if you don't want to be labeled with a disorder. Labels aren't always bad, but I can use it to treat so many things. For myself, ever since my postpartum depression, I suffer with a bit of seasonal depression, and I can't wait to try it myself and have you take the journey with me. The thing about EXOMIND TMS is its advanced double coil technology is groundbreaking. It's a real game changer in TMS, which again has been used for decades. The way it's a game changer is that now we can offer many fewer sessions, and many patients get similar benefits to what they would get with the 36 session TMS of the past. The reason why many patients get these effects in so many fewer sessions is because of the higher pulse delivery and deeper stimulation of the brain. So now an average protocol that I might prescribe would be 6 sessions, or that would be 2 sessions a week for 3 weeks. If the person gets a great response, and you remember I said that it often is better than talk therapy or medication therapy for many symptoms and indications. Now, medications are still a tool, and I think talk therapy is important. Relationships make the world go round. But now this is bringing it into the realm of being able to be affordable to people who don't want to use insurance to pay for it because they don't want to fail 3 other things, who don't want to be labeled, for people who just have symptoms and aren't diagnosed with a definite disorder. And if a person achieves a great response with this, which many do, then sometimes I might even recommend some maintenance TMS over time, perhaps 1 session every 3 months or every 6 months for maintenance. So for me personally, I'm going to try an initial 6-session protocol, 2 sessions a week over 3 weeks, each lasting 24 minutes and 50 seconds. It's very relaxing, not uncomfortable, more comfortable than traditional TMS as well, sometimes even pleasurable for some people. And after that, I will diagnose myself and my symptoms as to whether or not I think my symptoms could use a maintenance session every 3 or 6 months to keep away the winter blues that I often experience with a slight tendency toward seasonal affective disorder symptoms. But again, you don't have to have a diagnosed disorder to use this machine. This machine can be used just for brain optimization. It can be used, I can prescribe it for obsessive compulsive symptoms, depression with anxiety, just depressed mood, even without a diagnosed disorder, for PTSD symptoms, sleep, brain fog of menopause or post-viral brain fog of traumatic brain injury. It helps such a wide variety of people. I think you should give it a shot. I can't wait to try it and take you on the journey with me as I do.